We're right in the middle of the post-holiday coronavirus surge we were warned about according to public health experts. And as bad as it is, it's only going to get even worse, with people making reckless decisions like these super spreader-sized crowds that turned out in Tuscaloosa last night after Alabama won the college football championship. Then there are the 3 Democrats who tested positive for COVID after being locked in a secure room in the Capitol, alongside Republicans who refused to wear a mask last week. No lessons learned there either. Again, more than 3,000 people in the U.S. have died of COVID each day on average over the past week, and more than 200,000 a day have tested positive, all while vaccine distribution efforts continue to lag behind expectations. That's why Health and Human Services Secretary Alex Azar says he announced a set of sweeping changes to the rollout today, including a plan proposed by the incoming Biden administration.
We are releasing the entire supply we have for order by states, rather than holding second doses in physical reserve.
The Trump administration is also now recommending, they can't require it, that states offer vaccines to everyone over the age of 65 and those with underlying conditions. And they're pushing for vaccines to be available in more locations, such as pharmacies, community health centers, and mass vaccination sites. Here in Massachusetts, Governor Charlie Baker announced today that Gillette Stadium will serve as a mass vaccination site for first responders starting next week, and then will later offer vaccines to other groups for as many as 5,000 people a day. And not a moment too soon. Now that the state has been moved to severe outbreak status by the National Pandemic Tracker, COVID Act Now. But as welcome as the changes are to many, some argue the vaccine distribution process should be far simpler. Among them is Dr. Atul Gawande, one of President-elect Joe Biden's COVID-19 advisors. He's also a surgeon at Brigham and Women's Hospital, professor of medicine and public health at Harvard, and the founder of Ariadne Labs, which works to develop innovations in health systems. Doctor, it's good to see you. Thanks so much for joining me.
I'm glad to be here.
You wrote a piece about self-attestation, or a vaccine honor code. Could you explain what you're proposing and tell us why?
Yeah, the core notion is that you shouldn't have big eligibility requirements. You shouldn't have to show identification, like prove your age, show me your birth certificate, shouldn't have to prove where you work, shouldn't have to, in order to get the vaccine. We want to make it as simple as possible for the officials to administer so they don't have to create elaborate processes. There are some states that have imposed penalties if you get the wrong person who's ahead of others. And then if we're really clear about who we're prioritizing, yes, there will be the occasional people who jump the line, but I think we can hold people to saying, look, we need to follow the honor system, we need to make this simpler, and we need as many of you waiting your turn. We need the people most at risk to get the vaccines first.
But in this horribly immoral and unethical time, why do you presume that most people, the vast majority, will act ethically and morally, Doctor?
I don't think times have changed so much that people won't do that. And in the past, when we've had large vaccination campaigns and they've needed to have people attest to whether it's the side effects they may face or the medical history they have, people have been able to do that and stuck by it. I think the other part, though, is what it would take to implement the systems and the penalties and everything else to guide that process is overwhelming in a moment where the most critical thing is getting shots in arms. If some of those shots aren't in arms, but we're ending up leaving shots on the shelf because the systems aren't there, that's crazy. It's a clear priority. Get the shots out there.
Can I give voice to my cynicism one more time, and you'll disabuse me of it, and then we can move on? I don't know if you saw this neonatal ICU nurse, Jennifer DeVinson, who was on CNN a couple of days ago. She was talking about line jumping. There at Mass General Brigham, they have an honor code. Here's what this nurse had to say on CNN.
Whenever it rolled out, it didn't quite go as we planned. Like you said, it was definitely a slap in the face. Really, it was a free-for-all, and anyone could sign up. And it was put out on a Wednesday at 3 o'clock, and you had to log on at that exact moment. And if you weren't on at that exact moment, you were not getting the vaccine.
And Dr. Paul Bittinger, who, in addition to running the COVID task force advisory group for Governor Baker, obviously is a leader of Mass General Brigham, he acknowledged that the system, the honor system they put in place there, created what he called a sense of competition. You don't seem to be worried about that.
Well, what I'm worried about is, look, when we have systems that people have had no chance to have planning, I mean, most places got notified about needing to be responsible to have planning and have this set up just a week or so before Christmas. Yeah. They barely had any time to get it going. So you see things like in Orange County, Florida, where they say, well, first come, first serve. That just leads to a free-for-all. That leads to people feeling very ill-treated by. And then, of course, the people who can stay up all night for 8 hours are not the sickest elderly who need to come forward. I understand where those who are setting up systems are just trying to get them off the ground and working. Already this week, we saw the system go from 60,000 people being immunized a day to 600,000 people getting immunized as of yesterday in a single day. So, I see this as a system on the learning curve, and I worry about making it more complicated for the sake of these kinds of situations, rather than a simpler system, more predictable, and then people will understand, here's what I do. We need to set up schedules. We need to get people in the schedules and get it going. I'm involved very closely in the Gillette stand-up, for example, the partnership I put together to provide logistics and operations. A lot of it is about making it just clear and predictable as that opens up to first responders. Here's how you come, here's how you get scheduled, here's where you go, and make it straightforward. That's going to be job one over and over and over again.
I mentioned what Secretary Azar proposed this morning, including adopting what President-elect Biden has talked about, which is releasing every dose, holding nothing back for the second dose, believing that the manufacturing will gear up enough that the second dose will be available in timely fashion. But are these answers to the problem as to why we have 3 times as many doses distributed as have been shot into people's arms? Is the problem that we don't have enough willing recipients, or is it something else, Doctor?
Clearly, it's not that we don't have enough willing recipients. People are clamoring for the chance to have shots. Instead, what we have is a couple of things. Number one is a chronic situation of over-promising and under-delivering. We've had all breakthrough and no follow-through. So now, where there should have been 4 or 5 months of planning with the states, with the pharmacies, with county officials to help them prepare, they did not get resources. They didn't have an understanding of how much staffing there would be. Even now, as places open up capacity, you can't predict. There's no information about how many doses are going to be available in 3 days and 5 days. You want to schedule the second dose in 3 weeks. Can you open up and count on those doses being there? Part of going to a new administration is just providing much more transparency, a lot more strategy and planning. It will take time for the next administration to gear up for that. But these are things we know how to do. Make it happen in a handful of days, and we're going to have the chaos. It will improve, but it will take time.
You mentioned that we're now at 600,000 doses administered a day, and obviously everybody watching has heard President-elect Biden talk about 100 million shots in 100 days. But doing the math, 100 million shots is 50 million people with the required 2 doses. If herd immunity, according to the Faucis of the world, and I assume you as well, is somewhere in the 3/4 vaccinated range, the math suggests to me at that 100 million in a 100-day rate, we could take 1.25 years, 1.5 years to get to that point. Or am I right? And if I'm wrong, is it because 100 million in 100 days is just the starting point, and you think President Biden's going to be able to gear it up even further?
Yeah, much to unpack there. 100 million in 100 days, I think that we can get past 1 million vaccinations a day in due course. That we can get there in the next few weeks, especially after the new administration. It will have to clearly go north from there. 1 million will need to become 2 million, and then it will need to become 3 million. If the manufacturers can keep up with manufacturing and providing the distribution, I think it will be feasible to get the shots in arms to see the country vaccinated well before the end of the year. There had been a lot of talk that things would enable the general public to be vaccinated by the end of spring, and I think we're seeing now how gargantuan the task is. But I think that there is the capacity to steadily push this upward. Are there going to be multiple hurdles along the way? Yes. Now, the other thing to unpack is, where is herd immunity? The honest answer is we don't really know. It's somewhere between 70 and 90% with the current strains that have been around in the United States. The new strain is much more contagious. And if it's much more contagious, you've got to push those numbers even higher. The critical thing will be just getting as many shots into arms with as many Americans as possible over the course of the next several months.
You said a couple of minutes ago there's no shortage of willing recipients, and I don't doubt that at all, with one caveat. I have been appalled by the response by some frontline healthcare providers, whether in assisted living facilities or frontline people in hospitals that do jobs like you and your colleagues do. Is there any reason why vaccines should not be mandatory, at least for people who are providing frontline healthcare to sick people?
Well, I'll say one thing about the hesitancy. You have to separate people who have anxiety and concerns about, is it going to be safe? It is still a new vaccine. It's under an emergency use authorization. It's not gotten fully approved. It's still technically experimental. And it is understandable that people have some concern. It's a much smaller group who are actively anti-vaccine, who are going on the attack against this. And I think that hesitancy is something to listen to and let people work their way through it. What we've seen already this week is that interest and willingness to get vaccinated has skyrocketed since the rollout began. Once people see they have neighbors, they have colleagues, healthcare workers getting vaccinated and that they're doing okay. And in fact, they are starting to get a certain amount of freedom and normalcy that comes out of this.
Can we spend the last 90 seconds, if we can, Doctor, on another topic? For 3 years, you were you ran and then you were chair of the board of Haven, which was this joint venture from some of the big boys, Amazon, J.P. Morgan, Berkshire Hathaway, with this joint venture with the goal to ultimately deal with the cost and quality issues and that sort of thing. We all know it shut down a week or so ago. Did that experience give you any more insight into what would work on the reform front in this country, Doctor?
Well, I think there's a couple things. One is that it's clear that there are some problems that can be solved in the private sector and by employers themselves. There are other problems which clearly need the public sector. One big one is that when you have employees and you tie their health care to where they work, many employers only have those people for 2 or 3 or 4 years. Investing in what they need for the course of their entire life. We can use genomics, we can control blood pressure, we can address diabetes. Those require investments now for long in the future. And, all of this is an indication that we are still paying for the mistake of tying people's health care to where they work. That system is breaking even more under COVID. And so we're going to need the continuity that a public system, at least a public option, can provide.
Dr. Gawande, I really appreciate your time and your work. Thanks so much for spending it with me.
Thank you.